sinuses are spaces in the bones in the front part of the face, in the forehead, between the eyes, in the cheeks and behind the eyes. And they're air-filled spaces with a membranous lining, and this lining produces mucus. The mucus drains from the sinuses into the nose through narrow openings and then passes backwards and down the throat. Now, if those openings get narrowed in any way, it causes sinusitis. So anything that makes the lining swell, such as infection or allergy, blocks the sinuses and they can't drain properly, and that causes the symptoms of sinusitis.
Symptoms of allergic rhinitis are itching, such as itchy eyes, ears, nose and throat, sneezing, stuffy nose, and runny nose. Testing for allergies can be important if your symptoms are severe, if you have associated medical conditions such as asthma, or certainly if your symptoms don't improve as expected with treatment.
And that causes an irritation to the nose. That can be allergies, whether it be perennial such as dust or mold, seasonal allergies like trees, grasses, environmental irritants. You see some patients who are firemen who have chronic environmental exposures, construction workers. Cigarette smoking is a very common thing that we see that can exacerbate or worsen chronic sinusitis. And cigarette smoking is actually one of the most common causes of sinus surgery failure. So even secondhand smoke can be related. Other predisposing factors can be just a structural obstruction, the severe deviated septum, or a polyp or a growth, possibly a tumor that could be blocking the sinus passage. So their sinusitis is secondary to an obstruction from something else. So that's why I think looking in the nose is important. You may treat that infection with antibiotics and they get better. But if that person still has congestion, on that side of the nose, you really want to take a look and make sure there's not a polyp or a growth obstructing that sinus cavity that may get them in trouble in the future.
And I'd like to talk about sinusitis. Sinusitis is any inflammation of the sinuses which surround the nasal cavity. The small natural openings of sinuses can become blocked with any inflammation. Allergies and viral infection tends to predispose people for this. Typically, routine sinus infections can be treated effectively with antibiotics when they last for greater than a week. For some patients, antibiotics do not improve their symptoms significantly, and they end up with chronic infections that are weeks or months in duration. Most of these patients need prolonged medical therapy, but many of them also benefit from surgeries to open the small natural openings to the sinuses to allow medical therapy to be more effective.
Here you go with the first remedy. Take 1 teaspoon of fenugreek seeds, add them to 1 cup of boiling water. Once the concoction is ready, drink this thrice a day until the condition improves. You can reduce the intake once you feel better. Let's take a look at remedy 2. Take 2 teaspoons of apple cider vinegar, add a cup of water, take 1 teaspoon of honey, mix this well and drink this thrice daily for 5 days. Apple cider vinegar helps thin mucus so that it is eliminated easily. Let's see the third remedy. Take a teaspoon of ground and roasted cumin seeds. Add 2 teaspoons of honey to it. Mix it well. This should give you relief from sinusitis.
Stretch your legs out. Fold your left leg in and bring your right leg over your left leg. Make sure you're sitting comfortably, with your spine straight, shoulders relaxed. Now bring your left hand from behind you and then take the right hand and lock it with your left palm. Open out your chest and look up and breathe comfortably. You can stay in this pose for as long as you're comfortable holding this posture.
Inhale and then come up. Now lift your navel above the ground level. Push your pelvic bone down. Protrude your pelvic bone down and then elbow straight. Push the shoulders back, drop your knees back and then
Inhale, bring both your legs up and slowly bring both your legs up. Push your hips all the way forward and bring your chest closer to your chin. And elongate the lower part of your body, creating nice inversion. So your blood is inverted here. Just keep your breath normal.
Stand onto your knees and widen your legs really nice. So inhale, exhale, pushing your hips forward and slowly bringing your arms to your ankle and arch back.
Now gently take both the knees towards your chest. Interlock your hands. If you want more squeezing of your abdomen, you can hold both the sides of your elbow. Pull the navel inside as you exhale. Try taking the chin towards the knee. Don't take your forehead to the knee, then you'll be hurting your neck.